Hey guys, and welcome back. Today I am going to be talking about food sensitivities. So to begin, I'm going to be explaining the differences between a food intolerance, an allergy, and a sensitivity. An intolerance has nothing to do with the immune system at all. An intolerance is just lacking or not having enough of an enzyme to break a type of food down. So the most common example would be a lactose intolerance, which is where you don't have enough of the lactase enzyme to break down the lactose molecule. So this large molecule is traveling through your digestive system, giving you the lovely gas, bloating, abdominal pain, and unwanted bowel habits. That can happen. If you supplement with the lactase enzyme, that typically goes away. Allergies and sensitivities do have to do with the immune system. So with an allergy, you have an IgE immune reaction, which I'll explain in a minute what that means. And with an IgE immune reaction, you're getting a histamine release. So you're getting, that classic allergic reaction of hives, itchiness, that kind of tingling sensation of the skin, and in more severe cases, you're getting an anaphylactic reaction that can potentially be fatal. So you have a peanut, you start getting hives and itchy, you can take a Claritin or a Benadryl, and that histamine reaction will go down. It's easy to tell what the allergic reaction is because it happens pretty immediately after having that food. With a sensitivity, it's not as easy to tell because the IgG reaction, which is different than the IgE I just talked about, is a delayed reaction. So you're not able to eat a food and immediately tell that it's bothersome for you because it's a delayed reaction. It can also linger in your system for days, weeks, months even. So you're still getting exposure to that immune complex that can be aggravating for you. So it's usually within chronic conditions that you see a food sensitivity. So chronic headaches and migraines, chronic digestive concerns, chronic joint pain, and the list goes on. What is a food sensitivity test? It is a blood test that measures the amount of IgG complexes of certain foods. And there's a list of between 120 to 200 different foods that it's testing against. What is an IgG complex? Well, let me tell you. What are IgG complexes? I know, this is going to be fascinating. But I'm going to use an analogy to help me explain this. So in this instance, there are IgG antibodies, and they're going to be represented with garbage bags. There are antigens from the food that we eat. So if we're eating an apple, apple's going to have an antigen associated, and that's going to be represented by garbage. There are also these immune cells called macrophages, which come in and they sweep up things. They're kind of like the garbage truck in this scenario. So when we're exposed to any food by eating it, we're going to be met with some IgG antibodies to help put that garbage into garbage bags, more or less. So if I have an apple, it's going to be met with IgG antibodies for that apple. The garbage goes into the garbage bags. Great. And then these macrophages, which are the garbage trucks, come along to sweep them away to keep our immune system clear and us to continue to work the way we do. The problem is, however, at a certain point, if we're being exposed to something too much or our immune system's overreacting to it, then the macrophages are overwhelmed, so we don't have enough of these garbage trucks to get rid of these garbage bags, and these garbage bags accumulate in our bodies and tissues, leading to inflammation and causing chronic symptoms. That's why foods that we eat regularly show up on food sensitivity tests, because we cannot have an immune response to something we're not eating, if that makes sense. So IgG antibodies are a normal response to food. It's a perfectly healthy and normal and expected, but like everything, it's to what extent is it happening? Is our immune system overreacting, or is the burden just too high that we can't deal with it? So sometimes there can be a large list of foods that show up on people's food sensitivity tests in the highly reactive section, and that doesn't necessarily mean that those are the person's food sensitivities. But you do have to ask the question, what else is going on here? So I will often look to the gut first. And two kind of buzzwords, leaky gut and intestinal permeability, are often at play, which just means that the tight junctions between cells, which are kind of like gatekeepers, allowing things between the intestines and the blood, have been compromised due to inflammation from stress, foods, potentially dysbiosis, and now things that are getting from the intestines into the blood that shouldn't be are causing an over-exaggerated immune reaction. But I'm going to touch on that more in another video. So who is a food sensitivity test used for? This is really dependent on the person, of course, because everything is individualized and is up to the discretion of the healthcare practitioner. Usually it's used when people have chronic symptoms. So if somebody comes in and they've been having allergic reactions to things, even if that's been a chronic issue for them, I wouldn't order an IgG food sensitivity test because that's a different aspect of the immune system. So this is more symptomology like I've been talking about, and the three things that it's been most well researched for are IBS, which is irritable bowel syndrome, for migraines, and for weight loss. I also wanted to touch on what the cons of the test are as well, and this is a conversation that I have with all of my patients. So one is that there are false positives that come up on the test, which means that, let's say pistachios come up, but I never have pistachios, so it's not something that I'm actually sensitive to. Now this can happen for a couple of reasons. A false positive can come up because of a cross reaction with a food. So that's just essentially when one sort of food looks like another food that I eat often, and so it's creating this immune response like I eat that food often. Again, using the example of pistachios, I never ever eat them, but they came up on my food sensitivity results. So it's because the pistachio looks something like a food that I eat often, like chicken, let's say. So it's creating that immune response. Another reason for false positives is leaky gut, which I will touch on in a future video. Another potential con would be the restriction aspect to the food sensitivity test. So let's say that I have 12 different things show up on my highly reactive list, and I have to eliminate those things for 4 to 6 weeks. I would say more on the 6-week side of things to make sure that all of those IgG complexes have been cleared from my body, so I'm not getting those symptoms coming up. So I eliminate those foods for 4 to 6 weeks, and then at that point I start reintroducing them really slowly so I can see how my body reacts to them in a very real way. It's not just a number on a piece of paper. I can feel the symptoms from the foods that I eat. If I don't react to a certain food, I reincorporate it and I just go on with my life as I did before. If I do react to that food, it tells me something about that food in my immune system, so I continue to eliminate it and work on some gut healing, some liver support, so that hopefully later on that food can be reintroduced. The reason I wanted to explain this was because it doesn't mean that you have to restrict this whole list of foods for the rest of your life. That is not the point of this test. It's a therapeutic way to identify what your potential aggravators can be, eliminate those to reduce the burden on your body, get in there, heal your body so that you can reintroduce those foods later without having any symptoms. For that reason, I wouldn't recommend this test to somebody who has a history of disordered eating or eating disorders because that can be quite triggering for people. So again, this is completely individualized from a person-to-person basis. It's really important that all of the pros and cons are explained to somebody before deciding to go through with the test because it really is about informed consent and knowing what all of the pros and cons are and what your other options are. So the other option to a food sensitivity test would be an elimination diet. And that is when, for about 4 to 6 weeks, again, sometimes longer, you eliminate a list of foods from your diet completely. And this list is about 20 to 30 different types of foods that are most commonly reactive for people. So we're reducing the burden in your body, eliminating those IgG complexes that create your chronic symptoms, and then reintroduce very slowly to see what your reaction is to them. So you're doing the same thing you do in a food sensitivity test. You're just doing it with a predetermined list of foods that's a little bit longer than what usually comes back from a food sensitivity test. So it's less specific, but you're ending up with the same information and it doesn't cost you anything. So remember that food sensitivity test results are not permanent. The test is not diagnostic, and there are other options to determine what food sensitivities you may have. As always, please like and share if you found this information helpful, and don't forget to subscribe to stay up to date with the weekly videos. Bye for now.